You're going to put one truck with the bedpan. Remember, you have to put the bedpan. You can put the truck like this. You put the bedpan on it. But if you put the bedpan and you graduate that you empty the drainage bag in, we don't show you that procedure yet to empty it. You will fail if you put them on the table. For the table is where the patient eats. You put the bedpan on the chair. And then on the table, you put a towel and a washcloth. But the patient is going to wash her hands after she's going to wipe her own self, you know. This is a patient that can help herself. You put a towel and a washcloth, and you put your toilet paper on the table, and you put a pad to put under her bed before you give her the bedpan, and you put your gloves. All right? Then you have all your things. Provide privacy. All right. Now, if you read the prometric book tells you to put on the gloves just to remove the bedpan. But we teach you to put it on from now. And it's all right with the examiners. Are you going to be going under the patient? You need the, I think you need the gloves on. You understand? So the examiners them accept it. But in the book they say to put it on just to remove the bedpan. So if somebody does it that way, they still wouldn't fail. You know, just put it on when they get ready to remove it. But we teach you to put it on from now. Okay? We provide privacy already?
Yes.
Are you going to say, Mrs. Smith, please bend your knees for me and raise your hips. Mrs. Smith, you listening to me? Yes. Let me put this pad to protect your bed.
All right.
Then you get the bedpan, raise your hips. Remember, if you turn it this way, you're going to feel. You must turn it with the wide part to the back.
Yes.
Raise your hips. Okay, then you put your hand over. Are you comfortable on the pan, Mrs. Smith? Are you warm enough? But she's supposed to be an elderly lady, you know. Now, when you put her on the bedpan, ladies, you raise the head of her bed. Let me raise the head of the bed so you'll be able to use the bedpan sitting up. Raise the head of the bed. Very good. Are you comfortable? Let me make sure you're still on the pan. All right, you fix her. Are you still on the pan? All right. Very good. This is your toilet paper.
When you finish,
remember to wipe yourself from front to back.
Okay.
This is your call signal. Please call me when you finish using the bedpan. I'm moving away to give you privacy. Don't draw the curtain. It's to move away. And the minute I move away, you say, nurse, I'm finished.
Nurse, I'm finished.
Right away. You understand?
Yeah.
You finished, Mrs. Simmons?
Yes.
Let me remove your toilet paper. And let me, in the book it says, when you read it, ladies, you see, when I teach you this procedure, you must go back and read it in the book. The book, and you're going, the book going to say, lower head of bed before removing bedpan. You understand? And it will remind you. When you come back, before you remove the bedpan, you must lower the head of the bed. Let me lower the head of your bed, Mrs. Smith, before I remove your bedpan. Right, then you say, Mrs. Smith, please raise your hips for me. Okay, and go back down nicely, Mrs. Smith. And you cover this. Hold it like it's full of feces. Hold it good. Cover the stool out your face. And take this truck with you. You follow, ladies? And in the sink, in the test room now, you go to the sink area. Push. You put this truck in the garbage. Okay, ladies, now watch me. You do like this. And you get a barrier to hold the bedpan. Hold it good like it's full of feces. And you put this truck in the garbage. And you stand up. But remember, this is demonstration, you know.
Yeah.
There's no stool in here. What you are really telling the examiner, you are telling her how you would handle real stool when you become a nurse's aide. You are saying to that examiner, when I become a nurse's aide, if I gave a bedpan in a nursing home or so, this is what I would do. I would check the stool for abnormalities. If there is none, I would empty it into the toilet and flush it. And I would disinfect the bedpan and put it away. And if you see any disinfectant, for sometimes the students say, disinfectant spray like Lysol, you spray it out and take a paper and wipe it. You understand? But if you don't say it, you tell her you would disinfect it. That's all. You don't have to make no motion or nothing. Just talk. You follow? And after you say that, you open the cupboard and put it away. And you put these in the garbage. And you finish now, you take off your gloves. And you wash your hands. Yes. And you just finish handling stool, so you go and wash your hands. And you come back, and you take the toilet paper and put it away. This is indirect here, you know, how you put away your supplies. And what you do with this towel?
You wait.
Put this towel long ways, like that. And you go to the sink and wet this for real in the test and squeeze it out. Wet it for real. Put it on the towel. Hold it like this. Take it to the pin. Mrs. Smith, you had a good bowel movement. Okay. Wash your hand with this wet wash.
Yeah. Thank you so much.
Dry your hand, Mrs. Smith. All right, and you put it in the hamper. And then you put the table back to the bed. You go back to her. You cover her up, Mrs. Smith. Are you warm enough?
Yes.
Are you comfortable? Is there anything else you need?
No.
This is your call signal. Call me if you need me. Let me lower your bed for your safety.
Okay.
You all right, Mrs. Smith? You want to get up in the chair?
No.
Or you want to remain in bed? Would you like to watch the TV?
Yes.
Okay, I'll turn on the TV for you.
Okay.
Thank you for your cooperation.
All right.